Stumbles a step closer to grace. Every tear wipes the doubt from your face. With faith as your compass, you'll never stray. The path is lit in His divine way. If at first you don't succeed, try again. Through the storm and the pouring rain, we serve a God so great and true. He'll guide the way and carry you.
Amen and praise the Lord. No truer words have ever been spoken. I myself had to take the NCLEX 3 times back in 1997, and that's why I am still tutoring today. For those of you who are new to my channel, I'm your host and tutor, Annalise Garrison, and in this presentation we're going to learn how to use the clinical judgment measurement model to actually answer your NCLEX questions. So I made a video about the clinical judgment measurement model, and I will put it in the comment section. But let's quickly review the 6 steps of the clinical judgment measurement model. Now, for those of you who are old school, you're going to remember the nursing process, and you're going to remember 5 steps, add pi, right? So what I want you to do is forget the nursing process and just use the clinical judgment measurement model from now on out, okay? So the first step is recognizing cues. In the nursing process, this would be part of the assessment, right? So recognizing cues, what is the signs and symptoms of the disease process or injury? What is wrong? Step 2, analyze cues. Old school nursing process, this too would also be part of the assessment, the A in add pi, right? So when we analyze cues, we are critically evaluating the patient data to identify meaningful patterns. How does all this fit together? Here we want to connect the dots and start thinking about what? The D in the nursing process. What is the D? Diagnosis. So take your cues and analyze them. What's going on? What diagnosis are we going to come up with? Now, with the clinical judgment measurement model, they replaced diagnosis with prioritized hypothesis. You know why, ladies and gentlemen? Because when we read the case studies, we could come up with 3 or 4 diagnoses, right? So that is the hypothesis. What do we think is wrong? When we recognize cues and analyze cues and start to come up with possible diagnoses, we don't know if this is the right diagnosis, right? This is just a hypothesis. So the clinical judgment measurement model is calling the diagnosis a hypothesis, because that's just what we're doing. We're giving our professional opinions to come up with a diagnosis. This is a hypothesis. We prioritize the hypothesis because when we read a case study, we could have multiple issues going wrong, awry, right? We can come up with multiple diagnoses. It's our job as a nursing student to focus on the priority diagnosis, right? So this is step 3, prioritize hypothesis. Okay, step 4, generate solutions. Old school nursing process, this was called planning, right? All right, so when we generate solutions, remember, what is your plan of care of said disease, process, or injury, right? What are you going to tell all your other fellow nurses and multidisciplinary team what to do? This is where we write down the problem and we come up with a plan. Now, once we write down the problem, what are we going to do? Old school nursing process. It used to be called interventions. What is it called with the clinical judgment measurement model? It's called take action. What is the nurse going to do for the client? When we answer NCLEX questions, the take action takes priority. I'll explain that in a minute. The nurse's actions always take priority when answering NCLEX questions. And last but not least, evaluate outcome. For those of you who are old school, you know that if you learn the nursing process, evaluation was the last step in the ADPI, right? So it's kind of the same with the clinical judgment measurement model. It's just called evaluate outcome. Same thing, right? Is your client ready for discharge? So when we answer NCLEX questions, and I'll do 2 questions in this presentation just to show you an example. And when we tutor together, we're going to go over case studies and standalone questions and all that kind of good stuff. But so when we do this in practice, recognizing cues is the signs and symptoms, the history, the presenting disease process, the illness or the injury, right? When we read the case study, this is what recognizing cues entails. Now, the answers that have the nurse taking action always gets picked first. All right. Now, if there is no nurses taking action in the answers, then you want to do recognizing cues first, analyzing cues second. Prioritizing hypothesis really doesn't come up in the choices. Like I said, I'm going to do 2 questions as an example. I'll show you here in a minute. Generate solutions always get picked third, well, fourth if you're going to do take action first, right? And then evaluate outcomes is last. So for the answering of the questions, take action is first, recognizing cues is second, analyzing cues is third, prioritize hypothesis doesn't really come up, generate solutions is fourth, and evaluate outcomes is fifth. That's the order of how we pick the proper answers. Now let's look at some examples. All right, here is question number 1. Now, for the purpose of illustration, ladies and gentlemen, I have recognizing cues, analyzing cues. I have them all in different colors, okay? So now what we want to do is we want to look at our answers and say to ourselves, hey, is this answer recognizing cues, analyzing cues, prioritizing hypothesis, generating solutions, taking actions, or evaluating? See, we're going through all 6 steps of the nursing process, of the clinical judgment measurement model. Now let's look at this question. The nurse is assigned as a preceptor to a newly hired nurse. Which of the following, if performed first by the newly hired nurse, would indicate his or her ability to prioritize? So, A, obtaining a blood glucose level for a client with a history of hypoglycemia who recently returned from surgery. Okay, this is about the nurse doing something, right? Obtaining a blood glucose. So for the purpose of this slide, I put a green or teal colored circle, right? The same color as take action. You could put a TA, you could put, a teal colored circle. However you want to remember the steps of the clinical judgment measurement model. But this is how I want you to do it. All right, so A is take action. B, performing a neurological check on a client with primary hypertension who is reporting right-sided weakness. Again, performing a neurological check. Take action, right? We're not recognizing cues, right? We're not doing any of this. What we are doing is performing a neurological check. So put a TA next to it. Put a TA next to B. C, assessing the pain of a client who had a thyroidectomy 2 hours ago and is reporting a sore throat. Again, that is take action. The nurse is doing something, assessing the pain of a client because he's reporting sore throat. All right, so put a TA, put a teal color circle, whatever you want to do. D, checking for the return of a gag reflex of a person who has returned from surgery 15 minutes ago from a bronchoscopy and is NPO. Again, this is take action. So, because the nurse is checking for the return of a gag reflex. Okay, Garrison, this was no help at all. I got 4 take actions. How are you helping me answer the right, pick the right answer when they're all take action? It didn't work. But it does work, because remember the video that I made about stay in the now, not the past or the future? When I teach you how to prioritize your NCLEX answers, you got to think about all the strategies I'm teaching you, not just one strategy, in case the strategy doesn't work. So in this case, we have 4 take actions. This strategy is not going to help you. So you build on now, past, or future. Now let's use that strategy. Okay, now I did make a video about stay in the now, not the past or the future, and I will put that in the comment section as well. Please review it. So, the first strategy, let's go back to that now, past, future strategy. Okay, let's read the answers again. Obtaining a blood glucose level for a client with a history of hyperglycemia who recently returned, still in the past, right? It's not happening now. They have a history of something and they returned, all right? So this is past. So in your mind, put a P for past because we're supposed to stay in the now, not the past or the future. All right, let's read B. Performing a neurological check on a client with primary hypertension who is reporting right-sided weakness. This is happening what? Is this happening tomorrow? Did this happen a few minutes ago or a couple hours ago? Do they have a history of it? No, it's happening now. Performing a neurological check on a client with primary hypertension who is reporting right-sided weakness. So put an N for now. This is happening now. C, assessing the pain of a client who had a thyroidectomy 2 hours ago and is reporting a sore throat. Okay, we already know we have to take action. All right, we already gave this client a green circle or a TA. So we are taking action. But again, a thyroidectomy 2 hours ago. Past, ladies and gentlemen. Remember, the NCLEX is testing your ability to prioritize. You are one nurse. You have 4 patients. Who are you going to see first, right? We're going to take action, but not right now, because we have to stay in the now, not the past or the future. So give C a P. All right, let's read D. Checking for the return of a gag reflex of a client who returned from surgery 15 minutes ago and is from a bronchoscopy and is NPO. So we know we have to take action, but they returned from surgery 15 minutes ago. They can wait another 2 minutes, right? So that's the past. We have to stay in the now. So what is your answer? Your answer is B, ladies and gentlemen, because not only do we have to take action, which is a priority, but we have to stay in the now. We can't forget all of the strategies I teach you, not just one strategy. These strategies build on each other. They work together. So synchronize these strategies. Remember these strategies, because you're going to have to, fall back between them. Remember them with every question of the NCLEX. Okay, real quickly, let's do one more question, because I try to make these videos only 15 minutes. So, okay, question number 2. The nurse has received a change of shift report on the following client. The nurse should first assess the client. Okay, let's look at this. A, with sickle cell crisis, who has a hemoglobin of 9 grams per deciliter. Okay, now this is analyzing cues. Remember what I said just a few minutes ago, that analyzing cues is putting things together. This is where you look at the lab work, you look at your diagnostic test, and then you connect the dots, right? So this is showing and stating a diagnostic test, or actually some lab work, of a hemoglobin of 9 grams per deciliter. So that's lab work. So this would be A, analyze cues. Now, when we do our NCLEX, take action comes first. Recognizing cues comes second. Analyzing cues gets picked third. All right? Remember the order. Let's read B. With pneumonia, who has an oral temp of 101.8. All right, so this client has a temp. Not good. So what is that a sign and symptom of? That's a presenting problem, right? It's a sign and symptom. It's what's happening now. So that is recognizing cues. We know that they probably have that temp from the pneumonia. All right. Let's look at C. Who has a femoral phlebitis graft bypass surgery and is reporting slightly more pain than before the surgery. This client is reporting something. The nurse needs to do something about that, right? The client has a problem. They're reporting it. We need to take action. So put a TA next to C, or a little teal colored circle. All right, let's read D. Has pneumonia and is expectorating blood and is reporting chest pain upon inspiration. Okay, this client is reporting something to you. We need to take action, right? So put a TA next to D. So to summarize, we have a analyze cues, we have a recognize cues, and we have 2 take actions. Now, if take action takes priority, we can forget, we can X out analyze cues and recognize cues. We can eliminate answer A and B. So now we're left with C and D. Both of these answers need us to take action. But which one do we pick first? Well, if we look at D, has pneumonia and is expectorating blood and is reporting chest pain upon inspiration. Well, this, not good, albeit not good, but it's still signs and symptoms of pneumonia, right? So in a way, D could also be recognize cues, right? Because these are signs and symptoms of pneumonia. So in the end, since D is a sign and symptom of pneumonia, so you would be right by picking TA and R, right, with this answer. take action is always first, right? So we would pick C, because C is the only answer left with the one and only take action. And by the way, you should always pick the pain answer if the pain was caused by the medical personnel. If the pain was not caused by the medical personnel, do not pick pain. So that's another tidbit that you didn't know. All right? So if the pain was caused by medical personnel, pick it. If it wasn't caused by medical personnel, don't pick it. That's another reason we don't pick D. All right? So in the end, what is the answer? The answer is C. So there you go, ladies and gentlemen. That's a very simple way how to use the clinical judgment measurement model to answer the NCLEX question. If this is your first time taking the NCLEX, good luck to you and God bless you on your career. If you are a repeat test taker, please don't hesitate to visit my website or to call me today. I'll be waiting for your call because I am here to help you just like the Lord helped me.
If at first you don't succeed, try again. Through the storm and the